There's always been doubt about artificial intelligence, its function, that is going to get everybody sacked. But I want to reassure you that that's not going to be the case in the next decades to come. Today's topic is the role of artificial intelligence in assisted reproduction, revolutionizing fertility treatment for the future. What is artificial intelligence? Artificial intelligence are just computer and machine technologies that are made by humans to simulate human learning, comprehension, problem solving, decision making, human creativity, and they are autonomous. They are made to think and reason like human, but of course they don't have the feelings we have as humans. AI history is one of ambition, setbacks, and reinvention. It's not a new thing now. It started in the 19th century, where Aristotle explored logic and Leibniz imagined symbolic reasoning. These are early great philosophers who are who reason beyond their time in the 19th century. At the earliest 20th century, Alan Turing formalized computation and proposed the well-known Turing test. That is the beginning of early digital computers, which enabled serious artificial intelligence speculations. Early programs in computer complexity systems that simulate human reasoning gained prominence that time, but in the 70s and 80s, there was a doldrum that all known as AI waiters is a symbolic struggle because human intelligence reasoning capacity is very complex. It was difficult then to build a computer that will match our complexity in intelligence and reasoning. So there was a struggle. Nobody could make such a very high level technologically forward computers that could simulate our intelligence. So there was doldrum, everything was kept quiet. But in the late 80s, there was a resurgence when IBM started, thinking about high-tech computer again. They made random access memories, the storage memories that are so complex that could match human reasoning. And this gave an impetus to other researchers to say, hey, let's grab where we left. We can still continue our artificial intelligence project. So in the year 2000 up to now, artificial intelligence has gained a lot of prominence and is almost in every day or every aspect of our lives. Benefits of artificial intelligence and limitations in the healthcare industry are stated here. The benefits include enhancement and precision technology in healthcare. It improves our decision processes in treating our patients. It enhances early detection and prevention of diseases. It's made an evolution of personalized medicine, enhanced accuracy and efficiency, and of course it can be scaled very high, and it's useful for workflow automation. And it's very beneficial now, even now that we have worldwide shortage of medical skills. We all know about Japan. So with the help of artificial intelligence, it is possible, to defeat Japan syndrome. But it has limitations because it's what you put in that you get. There is data quality problems, dependence. Some people are saying, why should we human beings be so dependent on technology? Why can't we operate as our great forefathers have been doing? Of course, there are some ethical considerations in doing it. The need for clinical validation is also there. You want to trial a system in the medical field. You must first of all validate what you are going to bring in, because this is human life. So development and training of machine learning models has also been given some technical issues, data adequacy, choice of models. We go through all of this, and then, of course, applicability of the process. There are different types of AI models, but the ones we specifically, that function well with artificial reproductive technology is the machine learning. Machine learning simply by itself, or deep machine learning models. And we have several types of machine learning models: supervised learning, unsupervised learning, and of course reinforced learning. All these have applicability across the spectrum of artificial assisted reproductive technology. There are other types of AI models that are also being integrated into the process of assisted reproductive technology, including deep learning models, neural networks, generative AI models, as we have in ChatGPT. They can create a new content. So it's easy for us to say, ask ChatGPT or Google Gemini any questions, will give you loads of answers. But you need to be careful, because some of these answers might be wrong. We know with anything that is machine-driven. We have also agentic autonomous systems that can reason, and this is used in all the EMR, electronic medical records that we use, laboratory automations, and this is very useful when it comes to automation of the IVF lab. We have hybrid models that combine all these resources, and of course multimodal AI systems. Artificial intelligence is everywhere. It's in hospitals, life sciences, schools, smart homes, banking and finance, fake news even, entertainment, social media, WhatsApp, Instagram, Facebook, all aspects of human endeavor, even e-commerce or research and development that we do. However, it has made a special paradigm shift when it comes to healthcare delivery. It has helped us a lot in diagnostics, imaging, MRI, CT scan, surgical procedures. They've all been integrated with artificial intelligence to streamline the process, to be very precise when it comes to diagnosis and management, and of course to reduce mortality and morbidity associated with human diseases. Imaging analysis, we all know all about, detecting anomalies, patterns in medical images with high precision. Of course, patient monitoring is very important. We can have patients in ICU. Human reasoning and intelligence, artificial intelligence supersedes our own reasoning and intelligence, and it helps us to manage this patient very, very effectively. It's also good in prognostication. You can put in the patient's demography and all other data, symptoms and everything. It will tell you how the patient is going to move forward with the disease, where the disease is going to lead the patient. This can help us to prepare very well for the treatments. Benefits of artificial intelligence in healthcare industries is very enormous. So it is very impossible for us as medical practitioners to dump artificial intelligence in our realm of life. We just have to live with it, because it's the in thing, and billions of dollars are being spent every day by Microsoft and all the other big techs. Mark Zuckerberg, they have spent a lot of billions of dollars in this, in the process of developing, very efficient artificial intelligence. Artificial intelligence enhances patient care, offering accurate information, reduces care costs, reduces stress level and burnout of physicians. It makes better decision making. You see in all the following slides how it can, it's even better reasoning when it comes to assisted reproductive technology. It saves off a lot of time, and it prevents morbidity and mortality for our patients. A few days ago, I did a cross-street look on the National Library of Medicine website, and I found at least about 1,450 publications and it's still increasing. I'm sure if today, if I start the same again with artificial intelligence in reproductive medicine alone, I will get much more than this, currently as of today. We've all seen a lot of publications in our newspapers, on the TV, about artificial intelligence in reproductive medicine, advancing embryo grading and pregnancy prediction with AI, and has been very, very effective. First baby born using fully automated IVF lab, fully automated system in the IVF lab with very little contact or modulation by humans. This being achieved. So we are hoping in the next future this will gain a lot of grounds as we move forward. Let's give a brief overview of assisted reproductive technology. At least we know that 1 in 6 couples worldwide have infertility. That's the prevalence. 8.8% of United States population have infertility. 10 to 15%, across all the other countries like Europe, Asia. But in sub-Saharan Africa, our percentage is much more than what obtains in US or Europe, 15 to 30%. All because we have other comorbidities that prevent procreation, like septic abortion, diabetes, blood pressure, voluntary infertility, when young ladies postpone, childbearing until they have PhD or they are, well established. All this can lead to voluntary infertility, which by the time they realize, it might need special treatment to, put them back on the procreation line. Artificial reproductive technology involves intrauterine inseminations, IVF, intracytoplasmic injection of sperm, cryopreservation, reproductive medicine, surgeries, and genetics, and a brief look at what the process is like. We have a patient coming to us now, first time to the clinic. Oh, sorry, doctor, I've been married for a few years, but we are still here to have our first child. We start by, taking history from the patient, doing all sorts of examinations, and we carry out tests, including ultrasound scan, to try and find out what is the cause of infertility. Hopefully, we'll be able to know about this, but please, in 15% of cases, we don't find any cause, even when we have, investigated the husband, investigated the wife, and we couldn't find any cause. So we still need to, treat them. It begins by knowing your patients, knowing the cause, and trying to profile a treatment profile for them. We start by ovarian hyperstimulation. We give them injection and tablets. Instead of ovulating 1 egg in a month, we want to, harvest, or we want to retrieve as many as possible, at least not more than 10 to 15 eggs. And when we are collecting the eggs in our theater, the husband is giving us sperm in the next room. So we collect these 2 eggs from the woman, sperm from the husband. We take it inside our lab, we mix them together to make the embryo. This embryo we incubate in our incubators for about 5 days, and then we put it back into the woman's womb. 2 weeks after that, we do a pregnancy test. And it is expected that at least, if your clinic is right, you are doing what is right, you should expect at least about 50% pregnancy rate. It is not 100%. IVF does not guarantee 100% pregnancy rate, because even you ask a woman, go home with your husband, have regular sexual intercourse, the pregnancy rate naturally is about 10 to 15%. So if IVF could move it up to 50%, I think it's a great thing. So we cannot talk about assisted reproductive technology without mentioning the Brazilians, Patrick Steptoe and Robert Edwards in England. They did a lot of research, and they were persecuted along the line. But luckily, July 25, 1978, The first IVF baby was born, the lovely Louise. She has her own children now, not by IVF. So affirming that IVF babies are, normal babies, just like babies born spontaneously. So these are the heroes that made it possible for IVF, first IVF baby in the whole world. In Nigeria too, we have our own heroes, where Professor Osage, Professor Lateef Akinola, that gave the first IVF baby in Nigeria in 1986, which was followed by, Australia in 1982, first IVF baby, and then in USA, 1982. These two professors did a lot earlier on in the 80s and 90s by forming Nigerian Fertility Society to bring all the fertility professionals together so that we can all work together towards straightforward, streamlined treatment of our infertility patients. This Nigerian Fertility Society, founded in 1992, metamorphosed later to the Association of Fertility and Reproductive Health, which is the main organization that all the fertility practitioners and most of our obs and gynae belong to, and it wants to regulate fertility treatment process in Nigeria, because there's a lot of quacks along the line who are doing this mainly not in the interest of the patients. So this association has been in the vanguard to correct that. Since 1978, when we have the first IVF babies, we now have up to 13 to 50 million babies born worldwide, and we are still counting. In Nigeria, if you say we have, over the years, more than 10,000 babies, it's most likely an understatement. However, despite all the developments, in the 80s and the 90s, even up to this moment, average success rates of IVF still remains the same. Women below 35 years, they do have 35 to 50%, per embryo transfer success rate, take-home baby rates. And if the woman is more than 40 years, it can be as low as 3% and not more than 10%. We know we can do better. We can improve, the success rates, take-home baby rates following treatment with IVF by harnessing the technology and the paradigm shifts, integrating artificial intelligence applications. We know we can improve the success rate. But could this be the panacea that we all look? How has artificial intelligence being integrated into fertility treatments? AI roles in, assisted reproductive technology, it enhances our efficiency. We'll see it shortly. It is very accurate, and it moves us from subjective doctors, subjective researchers, to an objective, doctors and researchers. It mitigates inherent risk in assisted reproductive technology, infertility, IVF, risk like ovarian hyperstimulation syndrome, multifetal gestation. If we use artificial intelligence integrating into our processes, it could reduce all this risk. It automates what we do. You don't have to walk your head from 9 a.m. to 10 p.m. You can automate, you can delegate the job to artificial intelligence models, and they will do it for you very well. They optimize various processes in fertility treatments. Key areas of application include embryo selection, predictive analytics for treatment success, personalized treatments, and of course, dynamic patient monitoring and management. Current challenges we faced when we see patients and we treat patients with, for IVF is the variable success rates. You come to IFM, their success rate may be 15%. You go to another clinic, their success rate is 10%. You go to the next clinic, their success rate is 60%. So a lot of variability, and this mainly due to clinic proficiency or patient heterogeneity. Patients are different. One patient can never be the same like the other. And then in most of our clinics, we have a one-size-fits-all. A patient comes to you, what is our BMI? 30? BMI 40? We give the same treatment modalities. This is wrong because we need to personalize the treatment profile to increase the success rate. And this is what artificial intelligence is bringing to us. It helps us to personalize the treatment modalities for each of our patients, thereby streamlining costs, eliminating wastage along the line, and giving the patient precise treatment that the patient needs. Instead of using what works for A for B, you give the patient the right treatment that is good for the patient. So this is one of the benefits of artificial intelligence. It helps us to select the best embryos. Embryos are of different grades. We have grade A, B, C. We have 3AA, 3AB, 3AC. Grade A is the best. B is the next to the best. And C we don't want to entertain because it usually has some anomalies. And now with artificial intelligence, we can select the best embryo that we can transport into the woman that can give us best success rate. It also involves, it helps us with genetic print implantation test. If we have husband and wife that are sickle cell carriers, we can use IVF combined with artificial intelligence to streamline, take away the gene responsible for sickle cell so that they can have a normal child. These are all the benefits of artificial intelligence. There are specific artificial intelligence applications, at least as of now in 2025. I'm going to go through the next few slides to highlight those points. When we see a patient and we have the artificial intelligence models, it can help us to predict the success rates. Okay, this patient is coming to me. I know her age. I know her previous response to infertility. I know the problem she's got. I know the diagnosis of her infertility. I know her ovarian reserve. I can put all this data into my computer with artificial intelligence. Even ordinary ChatGPT. This woman is 30 years old. She's married for 5 years. No children before. Her husband has no sperm. So please, ChatGPT, tell me the best, correct way to treat this woman so that she can go with a baby. ChatGPT will give you, correct treatment modalities. But you as human, you need to be careful and look at the prescribed treatment modality by ChatGPT, because sometimes this can make mistakes, especially if you put in the wrong information. So artificial intelligence helps us to prognosticate. We can predict the success rate of take-home life by baby rates just by seeing the woman, without even giving the woman any treatment at all. And this saves significant cost, and it can avoid complications because we now have a streamlined, personalized treatment modalities or processes for that patient. We can also use artificial intelligence to predict ovarian reserve, how many eggs the woman has got left. Shortly after birth, a girl, God has given that little girl 2 million eggs, and that is it. She cannot add any more eggs as she grows older. So along the line, she's going to be losing 10, 20, 30, or even more eggs as she goes. And by the time she hits her first period, she will have about 400,000 out of the 2 million God gave left. She's still not going to have 400,000 babies. So she will continue to lose those eggs as she menstruates until she gets to 50 when she hits the menopause. So when a woman of 40 years or 30 years or 35 years come to us, we want to know, out of the 2 million eggs she got when she was giving birth to, how much of those remain, so that we can use that to plan our treatment modalities. In the past, we used 2D ultrasound scan, but now with artificial intelligence integrated into 3D ultrasound scan, 4D ultrasound scan, it's going to give us the results in a GV. You can see the picture on my left is a normal ovary, and you can see the picture on my right is somebody with polycystic ovaries. These ladies have loads of eggs. If you count this egg, it might be close more than 20 visible now. But the normal ovary, she might have 5 or 6. So these, we know that if we treat each of them differently, this lady has loads of eggs, this one has fewer eggs, we can modulate the treatment modalities to increase their success rates. So that is one of the things that AI has given us as fertility practitioners. It also improves our monitoring process. Through artificial intelligence, we start a woman that we start to treat. There are many, many modalities, models of artificial intelligence that are embedded in our processes that we can use, including ChatGPT, including Google's Gemini, that can help us to predict the treatment, the drugs we are going to give this patient, how many units of injections she will have, what are the tablets, how should we monitor her, when should we collect eggs, when can we trigger the woman. And this has been the benefit of the artificial intelligence because it helps me to streamline this patient's management. And it prevents me from wasting, drugs, because these drugs are very expensive. We all know IVF is a very expensive modality. But if I can use artificial intelligence to reduce the cost for the woman, it's a bonus. We can use artificial intelligence to decide on the stimulation protocol for IVF. And then using this system, it has been the machine learning, deep machine learning, it has given us a lot of leeway to reduce cost. And of course, we now have the data-driven approach to individualized ovarian stimulation. And this has led to increased live birth take-home baby rates. And of course, it has prevented complications like ovarian hyperstimulation syndrome, which, if not treated well, can lead to death. AI has also helped us, to analyze sperm. When a couple comes to us, we ask the man to bring a sperm sample. We look at it under a microscope. With artificial intelligence, we can streamline this. We can scale this up. Instead of seeing one patient in a day, with artificial intelligence, I can screen up to 10 patients in a few minutes. So it's been very, very beneficial. And these machine models help us with motility, morphology, and of course, whether the sperm has DNA fragmentation or not. All these are important profiles that we look for in a normal sperm that can assure us that if we mix it with the egg, it's going to give us a very good embryo. Nowhere artificial intelligence has helped us more than people without sperm. Some men come to the clinic, you look at their sperm sample, there is nothing there. And then in such men, we advise them to use donor eggs. But with artificial intelligence now, we can look very closely at the sperm under a microscope, with a microscope integrated with artificial intelligence. And it has helped a lot of women that we classify as no sperm at all, or that go and bring a donor, or that we have to get a donor for you. And in such instances, when we use artificial intelligence to screen the sperm under the microscope, we can find some sperm we can use for the woman. And we can see this couple in abroad, after 19 years of heartbreak, the husband hasn't gotten sperm at all. 15 failed IVF attempts. But one AI tool found sperm in what we physicians or humans have condemned as no sperm. And the couple are now very happy to that. It can also help us in egg harvesting, harvesting mature eggs when we need to harvest the eggs. What time appropriate? Because if we harvest the egg at the wrong time, we are going to get garbage in, garbage out. Artificial intelligence can help us to also grade embryos, find the ones that are best that we can use to treat the couple by using embryoscope, which is integrated with artificial intelligence. Most of our machines in the IVF lab are now so integrated with artificial intelligence, and our patients are better for it. This is a study carried out in 2022 and artificial intelligence versus human embryologists for embryo selection under the microscope. And it was found that artificial intelligence did 20% better than the human embryologists in predicting implantation rates by using the best embryo. Artificial intelligence selected best embryo. Human embryologists selected their own best embryo based on their vision. And artificial intelligence beat them hands down 20% of the time. In genetics, where I mentioned about sickle cell screening, artificial intelligence has aided, pre-implantation genetic screening out the sickle cell gene, and then making the couple not to have a sickle cell baby. Artificial intelligence enhancement has produced a lot of great benefits here. Artificial intelligence also is inculcated, as I said, all aspects of assisted reproductive technology, IVF, is embedded with artificial intelligence. AI in embryo freezing and storage has increased our post-store use rates. In also, AI in IVF laboratory automation. Our embryologists, when they get to the lab, you see, embryologists at work in the lab, they do a lot of things. They document, they prepare the sperm, prepare the eggs, they do the transfer, they do a lot of things. But with artificial intelligence, they don't need to do as much. So it's reducing embryologist burnout. It helps them to automate the system so that they can just use the machine, set it up, and they can go and drink coffee while that process is going on. And this has helped us to increase productivity among our embryologists. In Nigeria now, we don't have enough embryologists. And hopefully if we use artificial intelligence, as we are doing in our lab, trying to integrate artificial intelligence into sperm selection, embryo selection, and see how it's going to increase our success rate. So it's going to reduce the problem we have with embryologists, where when one embryologist in Nigeria serves almost like 20 IVF labs, but with automation automation of the lab processes, this will be a thing of the past. Embryologists are afraid this is going to take their job, but I can bet that is not going to be the case. We are not also going to forget augmented reality in gynae surgeries. A patient that comes with fibroids might be the cause of the infertility, and we remove the fibroids. And then she goes on, stays with her husband, and gets pregnant naturally. With the fibroids, she will not be able to do this. And we have a lot of our surgical processes also that is integrated with artificial intelligence, especially the robotics that are integrated with artificial intelligence. And this, during the surgery, before the surgery, after the surgery, has improved the prognosis and the take-home baby rates of our patients. So we thank artificial intelligence for that. But if we are going to adopt artificial intelligence in our lab, it's a transformational process. We have to go through the stages. There's no shotgun approach. You must first of all explore the needs. What do I need to which machine in my lab do I need to integrate with artificial intelligence? And then you have to measure the impact, of your desire. You need to plan for change by doing a trial of the artificial intelligence machine. And then if you find it worthwhile, you can adopt and implement. Then you audit your system for any upsides or downsides. Look at the recommendation from the audit process and implement it. If you find it useful, then you adopt that artificial intelligence. It's not that a vendor will come to me, okay, this machine has artificial intelligence, and I just take it up like that. I've got to plan for it, because this system is very, very expensive. It's not something that you go to the bank and to the market and get. The drawbacks for AI in reproductive medicine are also significant. There's problem with data privacy, algorithm bias, and then artificial intelligence research are done with Europeans. Then we just bring it and bring it to Africans. So we got to adapt it to our own local system so that it can work for our patients. Lack of transparency, over-reliance on technology, and of course, financial implications and ethical dilemmas. In Nigeria, cost is a major factor of artificial intelligence. It's very expensive, so not all labs or IVF units will be taking it up initially, but change is very difficult to process through an organization, so we got to plan for it. And then there's a problem. This machine have been using it for 20 years, and now artificial intelligence machine is coming. How do they communicate? Machine in 2025, Microsoft is saying Windows 10 off the line. We have Windows 11. Now, how do Windows 10 and Windows 11 communicate? That's been the problem. We have a lot of legacy machines in our system that we may need to replace, and that has a lot of cost implications. And of course, there's a lot of ethics. People are saying, why should machine take over my management? Patients come to you, I'm going to use my artificial intelligence during your care. No, I don't want to. I want you. You are the train, not the machine. So there's a problem. Some patients say, no. I'm not paying for computer to treat me. Use your knowledge to treat me. So there's a lot of problem with that some patients have. And then there's a lot of job security. A lot of people are afraid that artificial intelligence is going to take their job. But I can assure you that in the next few decades, that is not going to be the case. We'll still be on the one taking over the charge. Growing ethical questions. You must tell patients what you are going to do with artificial intelligence in their care. They must be aware. This will remove bias. This will remove intransparency. This will remove, they will tell you that as a professional, you are transparent, you are open to your patients, and the pros and cons of the treatment profiles are discussed. Of course, now everybody is using artificial intelligence, all the countries, but there is no proper care, proper governance of the system by the governments of the world. Everybody is just using it, but there is no governance, and that's been the problem why some patients are afraid. They don't want to be something that is not regulated. Don't come and practice on me. I'm not a guinea pig. So that's always been what we get. In conclusion, there's a strong future potential for artificial intelligence in assisted reproductive technology. By advancing its AI technologies, it's data-driven with security assured. My data is, no hacker can come and hack, my system, because artificial intelligence comes, the computer also comes with the complex security modes that prevents any hackers from gaining access to your machine. It helps with predicting genetic diseases, a lot of impacts on our system, on healthcare generally, higher patient satisfaction, improved IVF success rate, expansion of access to across the diverse populations. Thank you for listening, and we invite you to, at least some of us that are obstetricians and gynecologists, there is a Sogon conference coming up in Ibadan. Thank you.